To start the day is by talking about data ethics for local government. We're very pleased to be able to welcome today Rehana Ramesh and Brendan Kelly from Brent and Camden councils respectively, who are going to be talking to us about different areas of their work on data ethics. We're going to hear first about Camden's data charter from Brendan, and then Rehana's going to talk us through Brent's approach to data ethics and some interesting recent developments of how they manage their internal governance. I'm Eddie Copeland, Director of LOTI, and just to give a few brief words of context, it was almost this time last year that LOTI had kicked off a series of workshops to explore the issue of data and AI ethics. Unfortunately, that was one of the casualties of the first COVID lockdown. That series was cut short, but the key item of discussion was how we take the best guidance out there about how local authorities and other organisations should think about using data legally, ethically and responsibly, and actually turning it into practice. How do you actually turn it from a principle sitting in a document to ways of actual working? And a second and very related key point was, how do you get the citizen voice engaged in this conversation around data ethics, given that sometimes it can feel very hypothetical, sometimes quite difficult to wrap your head around? How do you meaningfully engage the public in that conversation? So today, very pleased to be able to share two initiatives with you that look at the citizen engagement piece and look at that putting it into practice piece. And from a LOTI perspective, we're really fascinated to understand and observe these two models with a view to seeing how we can give really good advice, not just to London boroughs, but hopefully to local authorities elsewhere in the country about how you can really, excuse me, put into practice the best guidance and ensure that your data usage are sort of worthy of citizen trust. On that note, very pleased to hand over first to Brendan from Camden Council to talk about Camden's data charter. Brendan, over to you.
Thank you very much, Eddie. Yes, so our work around the data charter is basically to sit on top of what is already a robust GDPR process that is undertaken by our data governance team. So Eddie, if you'd like to progress to the next slide. The background to the charter is effectively that in the 2019 I forgot what the event was now, but the leader of Camden Council, Georgia Gould, spoke about how data rights are human rights, and as such, that as a local authority, we should explore not just what we can legally do, but ethically what we should be doing and what our residents would like us to do as a data handler. And in the spirit of the Camden 2025 programme, we have already gone through several other public engagements around things like the climate crisis and health and social care, the integration of health and social care. So we wanted to go out and deliberate with our residents again on the subject of data ethics, and we thought that the formation of a data charter with the help of our residents would be the best way to create that framework and have a set of guiding principles. Eddie, yeah, if you can go on to the next slide, please. The basic aims of the data charter are to build trust and reassurance with our residents, and also through the deliberation to gain an understanding of what our residents think of us as a data handler and what they would like us to do with their data in the delivery of services. It's also to obtain that buy-in from them as well, because we need them to participate in order for us to have a solid data governance structure. We need them to be on board and inputting their data correctly and updating it when they are able to. And also we wanted to pioneer something that we thought we could bring to other local authorities for them to also use if they wanted to create a data charter in such a way. We also wanted to make sure that we didn't overburden council officers who are going to deal with any new bureaucracy that comes out of this to the point where it become a hindrance. One of the outcomes already, before we've even written the data charter up, is to amend our data privacy impact assessments to include a section about data ethics, so that all of our projects that involve data now have to go through a process where the person filling out the DPIA has to justify them ethically as well as legally. Yes, if you could go to the next slide, please, Eddie. So we divided the project into 3 basic parts. It was initially just 2, which was the distributed dialogue, which was a set of workshops that were supposed to be taking place in existing community groups, but as Eddie alluded to with his own data ethics program, that kind of fell foul to the pandemic last year, and we were unable to have these workshops face to face. And many of these community groups were tied up trying to support their communities with pandemic response, as well as also the community groups not meeting face to face. So we moved that online, but didn't have the take up that we wanted. So we've now added a second bit, which is the user research, to try and get a bit more direct feedback from our residents, to ensure that we get the level of feedback that we want to feed into what is the essential part, the third part, which is our resident panel. Now, the resident panel is a smaller version of a citizens' assembly, 20 to 30 residents. And the reason that we wanted to do that, to draw up the data charter with our residents, is so that we could reconvene it, because we don't want this to just be a document written in stone. We want this to be a living document that we can revisit, especially as the landscape of data changes and technology allows us to do more new and exciting things. We want to be able to reconvene the panel with new sets of residents so that they can revisit the charter and see if it's still relevant. Okay, just onto the next slide, please, Eddie. So just a quick look at the user research as we are looking to do this with LOTI's help. And the idea is to supplement what we got from the workshops, get some quantitative data through a survey, and then get some one-to-one interviews with residents where they can really give that feedback that feeds into the panel. And just onto the last slide, please, Eddie. And yeah, just a quick overview of the panel itself there, which I've spoken about, but I'll leave that for anybody who wants to read that on. So that's a whistle-stop 5-minute tour of the data charter.
Thank you for that, Brendan. And could you maybe just give us a few more details on, from what my understanding of the project, you've been presenting residents with different types of scenario for how their data would be used in order to make it a bit more tangible. Can you just tell us a bit more about the thinking behind how you've tried to enable citizens to get their heads around what can be quite a complex topic?
Yes, of course. Yeah, so the case studies that Eddie's talking about are what we have been bringing to the workshops, and we're still looking to use in our one-to-one interviews as well, where we've taken real uses of data, like the linking of health and social care data, for instance, or our involvement as a local authority in test and trace. And we try to ground what we're doing in how that benefits the residents, so that the residents that we're talking to get an understanding of how we're using their data, why we're using their data in that way, and it allows them to join the conversation. And basically the entire workshop or one-to-one interview then feeds off the back of that, so that once they have an understanding of how we use their data, they can then comment on what they think the good aspects of that are and what they would like to see us do going forwards.
Thank you for clarifying, and there'll be more chance to ask Brendan questions in just a bit. But so this is one piece of the puzzle. Thank you for that overview. Now hearing from Rehana Ramesh, the digital transformation lead at Brent, on their approach to data ethics. Rehana.
Thank you, Eddie. Hello, everyone. Eddie, could you just go to the next slide? Yeah. Data ethics, probably all of you have heard it at some point or the other. So I'm not going to go through what it actually means, but just want to give you a bit of background and narrative as to where Brent's journey started from. So within our digital strategy and our program, one of the key pieces of work that we wanted to deliver was build a data lake. When we decided we wanted a data lake to aggregate all of the data, you get a holistic view. We wanted to do predictive modeling, artificial intelligence, machine learning, and all of that kind of stuff. We knew much earlier on in our journey that if we wanted to use all of this technology in an effective way, we needed to make sure that we had a really strong data ethics board that we had access to be able to guide us and challenge us with our thinking and how we use technology. So that's how we started off. That's where the journey started off from. Like Eddie mentioned right at the beginning of the intro, one of the first things we did was actually have a memorably like a workshop with loads of key people. UCI, we had ODI with us, Alan Turing Institute, they were there, loads of other local authorities from a data perspective. And what we did in that workshop was actually test the different ethics canvas that is available right now to see which one is best suited. The plan was that after the workshop, we would split up different local authorities and we would test a canvas each and then come back in a couple of months to say what is the ease of use. Of course, we make plans and that didn't happen. COVID-19 happened and we had to pause that. However, the journey within Brent on building the data lake and embarking on that journey was in full speed. So around 4 months ago, we decided that we now have a data lake. We need to have an ethics board in place if we want to make the best use of that technology. And that's how we embarked on setting up a data ethics board within Brent. Eddie, could you just move to the next one? Yes. So we went with the Open Data Institute's ethics canvas, just very high level, just wanted to talk why. Again, it's because of the ethics principle themes that we have with the ODI, talks about privacy, accountability, safety and security, fairness and no discrimination, all the kind of things that you need to think about and have a process to say, how are we meeting all of these key principles or themes in order to make sure that you're making an ethical decision when it comes to data. I've actually embedded the link of the ethics canvas. So when we do share the slides, you'll be able to go and see the ethics canvas. It's really nice and simple, quite colorful. I can see Oliver is on this call from ODI. I don't work for the ODI, but it's just sometimes it's quite pleasing. You've got around 15 questions and each of the questions prompts you and makes you think. And it ranges, it goes from your data source to how do you want to engage with your citizen, what are the positive impact of using this data. So it kind of really stretches you and makes you think from all angles. Doesn't feel like it's an onerous process to complete it. So we went with the ODI's data ethics canvas. Eddie, sorry, the next slide. So there are two approaches that you can take with the ODI canvas. One is that based on the user case, based on the data that you're going to be using and what you would present to an ethics board, you can either get the department or the team who's going to be using the dashboard or the data completing the ODI ethics canvas, or you could actually get your board itself completing the ethics canvas. I'm going to come on to which approach, what are the pros and cons of each of the approach. But I think this slide for me really sums up why you need to have an ethics board and what the ethics board is about. One, it's about the data that you collect. So who, what, where, how, all of those questions, your sources, the impact. So the impact on the citizens, the impact on your residents, both positive and negative. So you've got to put different hats on. You can't just be like, oh, that's a great idea, this is going to do it. You really have to push yourselves to think, what is the negative impact of this? How we are engaging with the citizens and the data users. So this is not just about a fancy dashboard and saying, oh, it's a great idea, we know the impact it's going to have, but how are we going to then communicate this to our residents? And the process through which we will aggregate and analyze the data. So this is all of your legal stuff or your data lake, how secure things are and all of that stuff. Again, 3 key questions as suggested by ODI, which really, again, pushes you to think about the ethical element of what decisions you're making is what are the intended and unintended consequences, because sometimes there are things that might happen you would not have thought of. So it's like you don't know what you don't know. What are the positive consequences we want to focus on and what are the consequences we want to mitigate? So again, these are the key things that the ethics board in Brent will be focusing on. Eddie, could you just move to the next slide? Thank you. So like I said, there are 2 approaches and there's one where if you have a specific department who wants a dashboard, then they will complete the ODI ethics canvas and they have an outcome, or you would get the ethics board itself completing the ODI's ethics canvas for that particular user case. Now you can do it one of the 2 ways, but what we did is in order to facilitate our board's thinking, we put together what are the pros and cons for each. So if you have a service area completing an ethics canvas, then they get to really think about, fine, this data is telling us this, and this is how we want to use it. Who is the end user here? How is it going to land with them? How are we going to make sure that people are not misusing the data? So it's at that level. And then you have the board level where you can present the outcome of that canvas, which will be debated by the ethics board. our ethics board actually went with option 2, which is the service area or the department at that level would complete the ODI ethics canvas, and the outcome of that would be presented to the ethics board for them to be then able to, in a nice way, rip it apart or make sure that they challenge us with each of those questions that I shared in the previous slide. There are details in there about the pros and cons. Again, when the slides get circulated, please have a look at it. So Eddie, sorry, the next one, Eddie. Yeah. So where are we from Brent's perspective? So one, we do have a core data lake configuration completed. It was built on Azure. We have 2 user cases that we've been working on for the last year. One is a single entity of the child. So we call it it's basically a dashboard which pulls data from 5 different systems for the child, and it allows our social workers and our multi-agency hubs to be able to get a single view of the child via the dashboard. And then we have our rent analytical management system. So this is where all of our rent that we collect from our housing stock, we have a dashboard, and we're dabbling into doing some machine learning and all of that stuff in that particular dashboard. So those 2 user cases are moving on to the data lake. We're also scoping a financial inclusion dashboard. This is in response to COVID-19. So where we want to carry out preventive action with our residents to be able to intervene and support them from a financial perspective, to make sure that they are aware of all the grants or funding that is available to them. We make it easier for them to apply. Again, in context to COVID-19, Brent had the highest number of people who were furloughed in the first wave. So it's very important for us that we have sufficient information to identify residents who might be vulnerable and might have a massive financial impact because of COVID-19. So that's the first use case that actually is going to our ethics board. The ethics board has been set up. We've got 6 core members in the ethics board. 3 of them are internal. So we've got a strategic director who's the sponsor, and the chair of the ethics board who's the sponsor of our digital program. He's the chair. And then we have a legal representation from the council and information governance as well in there. And then we have a couple of people from external. So we've got a couple of universities. We've got a fellow researcher from ODI on the ethics board. We've got a lead doctor from the NHS Digital who actually does a lot of machine learning, AI, and is part of the NHS ethics board from Manchester as well. So again, it's a combination of people who are in this board, bringing in the right skill set, includes a resident of Brent as well on the ethics board. So we've got terms of reference. Of course, you would need that for the board. That's happened. We're working with ODI and we're carrying out bespoke training program for the ethics board members so that we can make sure that they have the background as well to be able to fulfill the needs of being a board member. And then we're also investing in making sure that we have sufficient facilitators across the organization to complete the ODI ethics canvas with the specific departments and the service areas as and when we come up with user cases. I think this is just the start of a journey for us. I wouldn't want to say that we are experts in this, but it's been absolutely brilliant setting it up. I think from a practical perspective, some of the things that really worked for us is the board challenged us on data quality. Again, that's a big issue. So you can have a fantastic system that captures all the data. You can have an ethics board that will make the right decisions, but all of that depends on having the right quality of data. Again, we're using our data lake to identify all the data quality issues and come up with a solution for that. So that's work in progress for us. We're also coming up with a data strategy, which is quite similar to what Brenton spoke about with the data charter as well. Again, I just think when you keep it in context of what is happening with COVID-19 and everything, having the ethics board, which is your gateway to challenge your thinking and saying, how are you using, have you thought of security? And all of that is actually quite valuable because every time we've had a conversation with them, we've had to go back and we have to think. And the ODI canvas really helps. Oliver challenged me, I must say. He said, even for your financial inclusion dashboard, he was like, okay, you're saying your resident is vulnerable, you get in touch with him, and then he says, I'm not vulnerable, what do you do next? I was genuinely stumped, and people say I can talk for England. And I was like, oh, yeah, hated it, but really made me think. So on that note, I'll finish.
Thank you very much indeed. A fascinating process and interesting to see both of you sort of referring back to ODI work, and it really does seem to stand out as a great starting point for all of these conversations, even with proliferation of lots of different principles out there. At this stage though, anyone with questions, and if so, please do raise your hand. Just whilst anyone's thinking about that, and so conscious we're a minute or two over time, but just to you, Rehana, can you give us any sense of how difficult or easy has it been to sort of persuade non-data colleagues of the importance of taking these kind of questions seriously?
It's a bit of a journey, isn't it, Eddie? So we've had some people who've been absolutely, itching at they saw the value of it quite naturally, but some of our department heads didn't see it. So, again, our head of customer access was like, well, why am I completing this canvas? Because we're using this FI dashboard. And I kind of used the same example that, Oliver did with me. And I said, okay, but how do you know this? And I think when you ask those right questions, they kind of think and they're like, see, it's because of this that we need to complete the canvas. It's because of this that we need to take this to the ethics board. And they can see the value of it because you've got to identify what is the benefit for them, isn't it? And if we can show them that by thinking this through properly, it makes the engagement and the communication with the residents easier for them, then they're buying into it. And proof is in the pudding. This is the first use case that's gone to the ethics board, and we plan to do some kind of show and tell sessions across the organization. So we do have like a data analytical group in Brent, like a networking group in Brent. We'll probably take something there and then probably do a couple of show and tells across the different departments to say, one, you've got data lake. This is the fantastic stuff it can do. Two, this is what we're doing in the ethics board. Interestingly, there are departments who reached out to me to say, can we bring our user case in here? And something, it was housing.
Fantastic.
Because they were doing Internet of Things and they were struggling with how to convince residents to actually give consent to put the sensors in. And they were like, if we can come to the ethics board, maybe then sharing that process with the residents will give them the reassurance that we're doing this the right way, that we have an independent board who's actually monitoring us. And that really helped. The fact that people can see the value of how the process can benefit service delivery. So it's been a combination.
And that's fantastic. That's almost exactly where we see this link between the Camden approach and what you're doing, and hope to be able to explore the pulling the two together. Mark, you have your hand raised. Over to you.
Yeah, thanks, Edward. Rehana, really interested talk there. Just wondering, the ethics board, what do they actually authorise? Is it loading the data into the data lake, or is it the specific use of the data once it's in the data lake?
I think it's both. So they give advice on what data can go into the data lake, and then how the data is used. So they're doing both. So they don't physically actually enter anything. Is the board? It's an advisory board.
And what do you actually sit on top of your data lake to do the reporting? Does it go through ETL processes and Azure Analytics, or do you use Power BI? Or
we use Power BI for the visualization. Yeah.
Okay, that's great. Thank you very much.
So thank you to both our presenters. If there's no further questions at this stage, please do look out for further updates. LOTI will be closely following and supporting wherever we can these two initiatives. We're really keen, as we say, to help share with local authorities really good, effective models for putting data ethics into practice. We're also looking carefully at how to get data ethics done really in a first-class way for pan-London data sharing initiatives. So look out for more details on that as well. For now, though, just hand over to my colleague Onyeka to tell us about next week.
Hi, everyone. Thank you so much for attending. Next week, we'll be having our first In Conversations With, and it will be in conversation with Martin Wallace, who is the Chief Digital Officer for Digital Office of Scottish Local Government. And we'll be hearing more about some of the projects that they've kicked off across the pond. So hopefully you can join us for that. It's the same link to register, so we hope to see as many of you there as possible. But thank you so much for joining us again.
Thanks all. Have a great Friday.
Thank you.
Bye.
Bye, guys.